Let's review literature that shows that methylation optimization is important for macular degeneration. We can start by just an overview. We would love to lower VEGF in the body and take care of these pigment epithelial cells so we can stop the conversion of dry to wet. Way back in 2004, they did a study of wet, dry, and healthy, and they found that homocysteine levels are higher in wet versus dry macular degeneration. And we can lower homocysteine by taking care of the methylation pathway after we check the genetics of the methylation pathways. That's 2004. Here's 2004 again. They found that homocysteine induces the expression of VEGF in retinal pigment epithelial cells. So obviously we want to lower homocysteine. 2006, a threefold higher homocysteine level in patients with wet disease and healthy controls. We want to lower elevated homocysteine. And also we want to make sure that we have enough glutathione, which is also part of the methylation pathway. 2007, 2,000 plus patients, again elevated homocysteine and low B12 are associated with macular degeneration. 2008, elevated homocysteine. If you treat the methylation pathway, you can lower homocysteine and you can lower VEGF. 2010, high homocysteine is related to the conversion to wet macular degeneration, as is low levels of glutathione. 2011, MTHFR is associated with wet macular degeneration. 2012, hypomethylation is associated with macular degeneration. 2013, they did a 10-year longitudinal study, elevated serum homocysteine and deficiency of folate and B12, which is a big part of methylation, predicted the risk of macular degeneration. So, we need to do something about that. Macular degeneration is associated with high homocysteine, which is linked to wet disease. MTHFR is clearly a methylation pathway issue. And elevated homocysteine can elevate VEGF, which is unacceptable. We can treat that by treating the methylation pathway definitively after genetic testing. Furthermore, steroids, not corticosteroids, but hormones, basically can benefit the retina as well. So there's another strategy by which we can help macular patients.